Hello, everyone. Joining us today, we have Ross McCabe and Andrea Welsh. I'm Athena Hall. We are here with Zena Health Network to talk about leadership in healthcare. So I'm a pediatrician in Seattle, Washington, and I'm passionate about including our communities in the design of our healthcare system. And if you want to introduce yourself, Ross and Andrea, go for it.
Sure. Hi, I'm Ross McCabe. I've spent the last 25 years in supporting health and human services organizations for public sponsored programs like Medicaid and Medicare, and have really enjoyed and focused on trying to work with not only physicians, but other members of the broader network of people who really make health and human services go, and how they can collaborate and come together and get results within public sponsored programs.
Yeah, my name is Andrea Welsh. I am a nurse and forensic medical writer. I'm certified in privacy or healthcare privacy compliance, and yeah, and I'm all in on this. I have been everywhere in all different levels of healthcare, so really glad to be here presenting with Athena and Ross.
Amazing. Thank you so much. And hello, everyone in the audience. If you have any questions or anything that you're curious about or want to add, please just let us know in the comments. And we'd love to have a conversation with you. So we know our healthcare system has its struggles and is pretty far removed from the people that it's caring for in a lot of ways. We have a traditional model that's really based around our business model of top-down leadership control. So it looks like everyone or many people are really ready for a shift in how we are operating in healthcare, what leadership looks like, and how everything is designed. So I'm curious what your thoughts are about what healthcare could look like, and what your thoughts are about our current model.
I agree with you, Athena. I think that the traditional leadership model, the way it's set up, it was built for control. That's how hierarchies are set up. It's built for control, not collaboration. And those hierarchies, they look really good on paper, but they really break down when it comes to real life, especially in healthcare in general. That model silences too many voices, and it really it protects the wrong ones, to be honest. And it breeds this kind of fear instead of accountability when it comes to actually being able to communicate within that structure.
Yeah, I love that you brought up fear and that control. So it is very much a fear-based system that's reactive, and really trying to make sure that it upholds that industry itself and make sure that it looks good. And so that really misses opportunities for accountability and growth and evolution as an industry that could be centered on the people that it's caring for, but instead it's centered on the industry and making sure that it's controlling its image.
Which seems completely bizarre when you think about it, because it's healthcare, that is people. That is, it's absolutely defined and run and all those things by people, and yet it seems so far removed from the humanity of it that it's its own contradiction.
Right. Yeah. Yeah. So really to shift towards a human-centered, people-centered healthcare system, we need to include people within the system as well as outside of the system who are receiving the services. We need to hear their voices, and they need to feel like they are equal partners in in their healthcare system. So, yeah, what are your thoughts, Ross?
I agree. I think the world has changed over the last few decades, and there are pockets of the healthcare industry and human services of success in following some of these shifts and trends. If we think about it, it's becoming a more decentralized world now, whether it's technology or how people receive training and earn licensure, how people collaborate and work together. I mean, just think about how we're working together here in this medium, as opposed to 25, 30 years ago, we would have needed to have flown to one central location and met physically in one place. And the only way we could have shared this conversation would have been by recording a videotape and then making physical copies of that tape. So the world's really changed, and it's important that we recognize, as we want to accomplish great things in healthcare, we want to improve outcomes, we want to improve the patient experience, whether this is medical, behavioral health, other community-based services. We really have to think about more of a bottom-up approach, and how do we convene people within organizations and between organizations, and how do we empower them to work together?
Absolutely. Yes. Yeah, that convening and empowering is so vital if we are to provide services that are really meaningful for people, and to have the impact that we really long to have. So many people in healthcare came into the industry because they want to help people. They want to see people around them thriving and healthy. And to do that, we need to have these um, these convenings with them where we can create a space where they feel safe to express what it is that they need, and what their deeper issues are, so that we're not just, um, putting out fires and putting Band-Aids on problems only to see them come back over and over again. Yeah, so prevention is really important in healthcare. Um, if we're really to see people healthy in our communities, we need to get to the root of their healthcare issues. This reactive leadership is something that we see across all industries, where people are leading from a place of putting out fire after fire, and not really doing the deeper listening and creating that space, so that we can understand what the deeper issues are and address them from the root cause.
I think that's one area too. When folks think about it, I know you mentioned that people get into healthcare because we want to help, and we want to help people. And when we see things start to fall apart, or we see the machinations that are going on behind the scenes, it's really easy to get angry,
Mhm.
and that doesn't help anybody. You can be upset at the way things are, but you really need to be curious before you're angry. Why is this not working? How can I fix it? And I know what that part of what we're going to be talking about here is rethinking how that leadership is, and how we go from that bottom up to kind of construct the way the hierarchy is. So that's just one thing I want to say with that. When it's so easy to get angry, and believe me, I understand, but try to keep that level of curiosity, because it's none of it is in stone. It can be changed, but anger is not going to do that. Curiosity and working with the bits and pieces, it's what's going to be able to have us make this change.
Yeah, absolutely. A lot of us working in healthcare and outside of healthcare feel a lot of anger about our healthcare system. And all of that is justified and needs to be heard to a point, but then we need to move forward, and know that, as you said, it's not set in stone. A lot of people feel like we're stuck here. We can't move forward. No one's listening to me. And um, I think to move forward, we need to listen and to have that curiosity. Uh, Curiosity is incredibly important in leadership. I think it's so important that we humble ourselves, that we don't have all the answers, and we um, we need to have that open curiosity to what else could we be doing? How else could leadership look? How else could healthcare look? And move from that place.
Well, and when we're looking at that, as far as leadership goes, when we talk about the hierarchies, but leadership isn't a title; it's behavior.
Mhm.
Yeah, 100%. So, true leadership shows up in, how people are speaking, how they hold space for others, in challenging that status quo. So that's something to kind of keep in mind as we continue to talk about this is just because you don't have that title, if you have the behavior, you're a leader.
Absolutely. Yeah, we are all leaders. Whether you want to be a leader or not, you're influencing the people around you. And you can do that in a way that's unconscious and just reactive, or you can do it from a space of intentionality where you are wanting to influence the people around you in a positive way and um, have a leadership that has those elements of curiosity and humility.
Right. Now, stop gatekeeping those leadership roles,
Hmm.
because behind those executive role, in those executive roles, and then start recognizing the influence at every level of the organization itself.
Yes,
Andrew, to build on that, I think we have an opportunity to add more to employee orientations or ongoing trainings or just part of culture that to give people permission, empower them to what are the things you're hearing and seeing. Because I've found just working in traditional healthcare organizations and insurance companies that sometimes people are surprised
Mhm,
that you'd call frontline workers.
mhm,
They're surprised that leadership's interested in their opinion and that the people who they work for are open to not necessarily complaining, but here's my idea of what could be done. Here are suggestions based on what I've seen. And I've also seen on the other side, I've seen people in senior leadership positions a little bit surprised that there are really constructive, at times, very practical ideas that people who are, caring for people every day have. And there's often not a formal structure to
mhm,
kind of give those a voice and a forum like a all hands meeting or a suggestion box or some kind of formal way to where those are not only submitted but they're discussed and whether they will fit in with the plan of the company for
mhm.
that year or not. There's a little bit of feedback from leadership as to why. I think just building that in more and giving that permission, I think organizations would find, big and small, that they can unlock a lot of energy and a lot of ideas that they're missing out on today.
Yeah, because the frontline staff, they're closer to the real problems, and they
hmm
usually have the solutions to them. Unfortunately, those usually come out as workarounds, and so they don't actually, not everybody knows what's going on because they're very kind of niche down workarounds.
Right.
And we see a lot of executive folks, they are just obsessed with the metrics and optics, and that sidelines the people that are doing the work, because they know what needs to change.
absolutely. Yeah, they're right there in the problem, and so are the patients. They see the problem much more closely, and they oftentimes have incredible ideas and insights into what could be done differently. I do think, some of the initiatives that are done in our healthcare system to include these voices end up falling flat or not really moving in any, gaining a lot of momentum or sustainability. And I think that's because our healthcare system is just not designed to have leaders within the system being heard and to have that inclusion aspect. Uh, the way our healthcare system is designed is built on a foundation that's centered around profits and the industry. And it's so hard to shift anything in the system without really changing that foundation. So I think moving forward, it's going to take a lot of us working together to shift that foundation.
Well, the system itself is built on overextension. I mean, it's everybody is, being pushed to their limits, and because of that, a lot of leadership rewards compliance over critical thinking, but that integrity is what keeps the system honest. So, those any kind of leaders who create change, they ask hard questions. They resist those performative fixes, and they center on the patients, the staff, and not the policy itself, because the policy may need to be rewritten, and the system itself obviously needs an overhaul.
Right. Yeah. Yeah, it looks like Jennifer wrote in. She said she likes the coactive leadership concept. It builds on this, where you have emotional intelligence and know how to show up based on reading the room. And the styles are visionary, intuitive, collaborative, servant, purpose-led. And you need to be agile between the styles. I love that.
Very much so.
Absolutely. I think one of the roles of a leader is to be a visionary. There's someone that holds the vision of the organization, and that could be a leader, anywhere within the system. They make sure that we are moving in that direction. This is what we want for our healthcare system. This is how we want to show up, and so having that visionary component is so important. And also the servant leadership, where you're there to lift everyone else up, to make sure that you're listening deeply. It's not about gaining titles, gaining power, and centered on your own, um, moving up a ladder. It's really about serving the people around you and uplifting them, and in doing that, the whole organization starts thriving. So
Yeah, because leadership used to mean that the person that was the loudest, the
right.
one with the title, the one with the power, had the final say. And today, it's much more about the one who listens when it matters, the one who speaks up when it's hard, and who takes responsibility when nobody's watching.
Mm-hmm.
And that shift from authority to accountability is kind of where we're sitting at right now. It's showing up for what's right, not what's easy.
Absolutely. Yeah. Yeah. Ross, what do you see in your work around that kind of leadership? Do you see people uplifting each other, or have you seen
Yeah.
good examples of leadership?
Yeah. I mean, just to speak from a very practical standpoint, um, there's a lot of change going on, like I alluded to in a comment a little bit before. And if we're thinking about even, from a quote, for profit perspective, in order to make the significant changes that are happening, whether we like it or not, the healthcare system, and to really shape those into something that we're proud of and is aligned with our mission, we have to think about this whole change management concept. And when people use the term change management, I always define this, because there's really two kinds of change management in healthcare, right? There's the IT version of change management, where people very diligently document things that are different and how that is programmed in the system. What I'm talking about right now is organizational change management. And, people use the framework of start with why and talking about that. And I think today there's a recognition that really a leader's job, as much as anything, is to help a group of people find a common reason why they're performing this change and what's the greater good that they're working towards, and then communicating what that is and helping people really find that common bond in doing that. And then in that way, other people can take action, and as a group they can collaborate and lead. But I think that until a formal leader um, works with the group to identify their motivation to even participate in the change and support it, I think until that happens and a clear communication of that, I just think there's a real limit as to what we can accomplish today.
Yeah, I love that. It really does. It's so important to have that collaboration so that people feel like they have ownership over that change. It's so hard to, how we have traditionally done things, is having that top down control, where it's like, this is the new change that we want and everyone will do it. And it's really hard. You have to push very hard to make those changes happen. And sometimes, they won't happen in the way that you want them to, or maybe those changes weren't really in touch with what's actually needed to be done. And so having that collaborative effort and creating the initiative together is so much more effective.
I
Yeah.
think taking that initial step too is to understand that, healthcare trains people to follow orders
Mhm.
and to defer up that chain, and that conditioning that that runs really deep. And I think that contributes to people not seeing themselves as leaders because they've been taught that, leadership lives in a job title. And so dismantling that, as you're talking about here, is a good place to start. And that's something that anybody can do.
Mhm. Yeah, absolutely. Yeah, really shifting how people perceive themselves within the system. I think also you have to build that trust with people, that over time showing up and continuing to ask those questions and continuing to listen and show them that their voice matters over time will help people to feel like, okay, I am a leader. I am somebody who matters within this organization, and people do want to hear my ideas. So I think that sometimes can take a little bit of time.
Mhm.
Um, yeah, I think another really important aspect of being a leader is being adaptive, being able to um, shift with changes that are happening. It could be with the people that you're working with. There could be conflict. There can be, pandemics. Um, there can be all kinds of things that come up. And we saw with our pandemic and with other things that have happened in healthcare that uh, there's not a really big capacity for that adaptability. It can be a big struggle sometimes. So, yeah, I think that's a really important aspect of being a healthy leader within a system.
Well, and I think part of that too is that being a leader doesn't mean that you have all the answers. And
Mhm.
it also doesn't mean that you're not going to make mistakes. And the biggest thing there is to be able to, be humble enough to listen, uh, really like relentlessly protecting the people that you're serving, whether that's patients or staff, and, empathy with a backbone. And then just understanding that, yeah, I'm not always going to get this right. And this is what I'm going to do to make it better next time. I think sometimes folks, especially in healthcare, I found they put leaders up on this pedestal where they can like do no wrong, and everything that they say is perfect and right, and that's just not human. Um, so we, being able to look at that both as someone who is working as a leader and then as someone who is looking up to a leader, saying, "Hey, they messed that up, and that's okay. How can
Mhm.
I support this? How can I help?" And having that grace to be able, not only with yourself, but with the people that are in leadership positions and the people that aren't, to be able to bring that collaboration together. I think that yeah, we're trying to get out of that habit of, well, they're in this position, so they have to know X, Y, Z. Not necessarily. So,
Yeah, they're human like the rest of us. Yeah, that reminds me of when I did my global health fellowship right out of residency. I thought I was supposed to be the expert and come in and have all the answers and tell the local people what they should be doing, how to operate. And I was humbled pretty quickly when I got there and realized for probably a month or so I was clinging on to this expert mentality, and it created a lot of disconnection with the local people as well as with myself, and made put a lot of pressure on me. And then I also found it hard to hold myself accountable or to admit when I was wrong because I was supposed to be this expert. And then I took a step back and I said, actually, I'm the learner here. Um, you know, People here know their health care system, they understand their culture, and I need to be learning more from them. We can share knowledge, absolutely, but getting off this expert box that really puts too much pressure on you and makes it hard to admit when you make a mistake. So that was a really great lesson in leadership for me.
Well, and that's where the change starts. You don't need permission to lead. You just need that clarity and that conviction and that consistency, and then that ability to step back and say, I don't know,
Mm-hmm.
and what can I learn? It's not taking an axe and like hacking pieces off of something. It's sculpting. You really
Right.
want to be able to take your tools. They have their information, whatever it is, whatever system you're working in, and you come in and you're just like kind of help guiding to shape it, and not just hacking off pieces.
Absolutely.
There's a
Yeah.
visual for you.
Yeah. 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 Ross, what about you? Do you have any thoughts on that?
No, I agree with what the two of you said. I think that permission is not needed. And back to what I commented on a few minutes ago, I do think, though, the formal leaders need to create the environment where people feel safe and comfortable, and we lead by example. And so that can be as simple as having group discussions, whether it's within a quote department or it's at a location, or it can be broader and what people might sometimes refer to as like all hands meetings, which can even be virtual. I think mirroring and demonstrating that all contributions are valued and they are absolutely needed, and sharing like examples of successes from this kind of interaction, I think that motivates people to do more of it.
I think it's an important part that's sometimes missed too, Ross, is exactly what you said there with, gathering ideas. I see this happen a lot. Like folks are like, oh, okay, give us all your ideas, give us your input and everything. And then they never hear another word about it. It's like,
Mhm.
what did you do with that? That circle back, I hate that term because it's a very corporate-y type
Mhm.
speak, but
Mhm.
that coming back and being like, okay, we took your stuff and this is what we did with it. Or
Yeah.
this is what I need you to do with this to help support leadership in general.
Yeah.
Because yeah, absolutely. The leaders have to make the space. And quite frankly, if the leaders won't make the space, then the staff needs to make them do it.
Yeah.
But they need to do that with that kindness and that empathy, to create that psychological safety. Modeling those boundaries. Knowing that caring for staff and whatnot is not it's not HR's problem. It's everybody's issue.
Yeah.
Um, I guess kind of putting that, like, I have a stake in this, and that everybody does. It's not just a job. You're not just going there for a paycheck. Because if that is your motivation, yes, it's important. But if that is your only motivation, you are in the wrong business.
Yeah. I think you could use like employee satisfaction surveys as an example.
Properly.
I've worked as an employee of two different Fortune 500 companies. So I've worked for very large companies. I've also been a consultant and been worked with very small companies. And a pattern that I've seen is that often, it's a very mechanical process, right? There's an employee questionnaire that's distributed once a year. Things are scored maybe 1 to 5. There are averages put out there. It's a little bit of a ceremony, and then nothing, quote, seems to ever happen from it. So I think we have to be careful when we ask for feedback or we ask for participation. What are we doing when we receive that feedback?
Hmm.
So are we asking the quality department to analyze the trends and scores and to report out what some of the top trends were for on the positive side and the negative side in an employee survey? And then is the leadership team working to spin up or identify one or more initiatives that year? So if we have a weakness and opportunity here and we give very clear feedback, what's an improvement opportunity that we can launch? And then the results of that opportunity, and then measuring how might that affect people's feedback that's recorded the following year. I think doing something with feedback really encourages people. Otherwise, in my opinion, employees just they hear the request for information, but they don't feel like it's genuine.
I think part of that too is to be able to accept and do something strategic with negative feedback. Because I've seen a lot of times where we do folks will do the employee engagement surveys, and there'll be some very serious problems. Like, we're having problems communicating with the providers. The providers aren't communicating back, all of that kind of stuff.
Mhm.
And they hide it and show, well, here's the good stuff. And there were a few things we need to work on. Call those out, because that's where you need to be doing the work. It's not, all sunshine and rainbows. Um, if you're not willing to actually step up and fix the problems that your own staff, then they're not going to have any faith in you to be able to do that. And staff needs to know that, hey, you're not seeing work being done on the problems that have been called out. It's like, hey, I know, at least I made a note on this. Then you have to call that out to your leadership as well and be like, why? You don't have to, y- change doesn't happen. You don't have to go rogue to do it, but you do have to be strategic if you want to make those changes happen. Know what battles you want to fight on this kind of things. But you do have to make that commitment to going ahead and being like, we're calling this out, and this is what we're going to do, and this is how we're going to do it, and these are how we're going to measure whether it worked or not.
Absolutely. Yeah, I feel like one thing that is a common thread in all of this is that leadership is relational.
Hmm.
It's
Mhm.
really about listening, having that humility, and building that trust with the people around you so that they know that you're listening, you're going to act on what you say you will, and what what they're saying actually has an impact on you and has an impact on the organization. So they
Hmm.
don't feel like they're just cogs in a wheel. They're, um, you know, dispensable. That mentality really is so disempowering and makes people, I think it's a big part of burnout in healthcare, feeling like you don't really matter within the organization. And, you know, when you bring feedback up, nobody's really listening. So I think as leaders, we really need to build those relationships.
Well, and I know that's something that I've adapted into my leadership style personally, is the whole trauma informed care aspect. Safety, transparency, choice, collaboration, and empowerment. Those kinds of principles, they aren't just for patients; they work for teams. So, because when people feel safe and seen, they will lead themselves. I know that a lot of times folks are like, well, I'm just A, and I personally hate when you're not just A.
Mhm.
But then you also have the other side of it where it's like, I am indispensable and all of the things. We all know the truth of it is, no one is indispensable, but everyone brings something unique. So being able to look at yourself and be like, okay, this is something that I can bring. I'm a pattern. I'm someone that likes to look at patterns, and I see patterns in things that others might miss. So that's something that I can look at and be like, okay, I'm seeing a pattern in documentation. I'm seeing a pattern in this. Being able to take that and be like, I'm offering this as something that I can contribute, and knowing that you have the ability to do that and that it's okay.
Mhm. Yeah, absolutely. And that's where, as a leader, when you're uplifting other people, you're really highlighting their gifts, making sure that they feel like they can step into those gifts and offer them and be creative. Um, and that's when organizations can be really thriving and doing so much good in the world, is when the people within it are able to show up in their unique ways and share their gifts. So, yeah,
Yeah,
that's
because
awesome.
healthcare is definitely not a set it and forget it kind of
Mhm.
kind of business. I think it's one of the things that is challenging for anybody who's, whether you're leading from the front or from the back or anywhere in between, is because you do have to constantly be on, because you have to be watching. When you're talking about being able to lean into people's strengths and to bring those out, by that same token, you need to be able to see when people are burning out, and when maybe something isn't quite aligned with where they need to be, and have the capacity and the foresight to be able to be, okay, I'm going to pull you back from this, and let's reassess and figure out where we can better use your talents or whatnot.
Yeah, absolutely. Yeah. Thank you so much. It looks like we're at time now. This has been such a wonderful conversation.
Oh,
I
absolutely.
love, yeah, I love this so much. Just thinking about new ways of leading in healthcare and how that could really impact our communities and within the healthcare teams, it could have such a huge impact on people feeling like they're part of something, they are contributing, and they matter. So
And that's the thing to remember, that you do matter, you are contributing. Find ways to make that happen.
yes, 100%. Yeah. Any last words or thoughts?
I think these are the things that leaders need to focus on. I think there are a few themes that we've hit on during this: communication, collaboration, empowerment. I think it's important. We can get caught up sometimes in all the details of subject matter expertise, but to the degree that we identify what those themes are as a leader and we discuss those with our direct reports, and then we communicate what those themes are and really hit on these things and how you're intending to bring these to life in your organization. I think that those are important steps to take.
Yes,
Yep.
absolutely. And not just saying those things, but really living those things. So,
Mhm.
yeah, wonderful.
Yep.
Thank you all so much. And we will see everyone in a month for our next LinkedIn Live. All right. Thank you.
Bye.